A mask is required in any patient care area. I think we all understand that. But also, a mask is required in any and all areas where a minimum of 6 feet physical distance can't be maintained at all times. And that includes common areas, break rooms, eating areas, or even when you're just walking around the facility. The problem is you don't know when that 6-foot barrier is going to be breached, and it's just not okay to guess. You have to protect yourself and others and wear your mask in all areas. And as an example, I'm here in my clinical office where a number of physicians share a common clinical space. We have it set up so that we have devices that are a good distance apart. They're at least 6 feet or 2 meters apart. But as you can see, I can't tell when somebody is going to walk through from one device to another or be within that 6 feet space. And so that's why when I'm here in a shared office environment or a shared eating area or a shared break room, I need to be wearing a mask. Well, some municipalities are in the process of enacting bylaws to require masks in indoor settings. So in some parts of AHS, this might be a little bit different. But regardless, continuous masking is a provincial AHS directive. It's a requirement as an employee or as a contractor at AHS. And the reason for that is obviously to ensure that our patients, our staff, the visitors and public that come into our facilities are protected from COVID-19. This is an extraordinary situation. The whole pandemic is an extraordinary situation. So it requires extraordinary measures. And wearing your mask is a part of that. It's caring for others and caring for yourself. If you're within an AHS facility or contracted facility, you're required to wear a mask in any patient care area and in areas where a 6 foot distance can't be maintained at all times. Again, it's incredibly difficult to predict when someone will walk close to you, closer than 6 feet, and as you move about the facility. So yes, if you're walking around the hospital or the clinic or another facility, you do need to be wearing a mask. Again, if you can't maintain a 6-foot physical distance from any other individual at all times, you're required to wear a mask or a face covering, and this applies to all non-patient care areas, in all zones, in all AHS facilities, or contracted or subsidiary facilities. If you're allergic to the mask that's available at the time that you enter the facility where the entrance management screeners are working, you can speak to your manager about accessing alternatives supplied through AHS. And in corporate areas, you can certainly bring your own face covering as long as you have no interaction in any patient environment. We're wearing continuous masking as source control to prevent the spread of COVID from an asymptomatic person to those in their environment. That's different than personal protective equipment, which is, of course, what we need to use when we're interacting with patients who may have COVID and to prevent the spread of known COVID from patient to staff member. The important thing is that my mask protects you and your mask protects me. It's one of the things that we need to do to keep each other safe. We need to wash our hands, avoid touching our face, wear our mask, don't come to work when sick, and don't forget to practice safe 6 feet distancing.
Together, we do amazing things every day.